Hello and welcome to Health and Wellness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. Welcome back to the Health and Wellness Podcast. I'm your host, Michael Swartz, Certified Financial Planner and Certified Physician Development Coach. And today I'm really excited about our guest. It is Gita Mehta, and she is a retired internal medicine physician from University of California, San Diego, who worked for over 30 years as a clinical educator. She retired in 2017 and has a bit of a unique story. And so with that, Gita, welcome to the podcast.
Thank you, Michael. Thank you for having me here. My story is I had no plans for retirement. I was thinking I'll work till 65. Life was good. I was a senior faculty member, a mentor, and I loved what I did. And my parents still lived back in India. And my mother got terminally ill, and I have no siblings, so there was no choice. I had to go back and help my father take care of her. And because there was no end date to how long she would be with a terminal illness, the only way to do it was to retire. So it was completely unplanned.
So completely unplanned. It really demonstrates the role that, family dynamics can play in a retirement journey. And for you, an unexpected and advanced termination of career. How did that strike you? I mean, when you ended up going back to India, how did that change your view of your role as a physician, as a daughter, and as an individual?
Yeah, great question. As a daughter, I felt that was my only option. And there was no second guessing or thinking if this is the right thing to do or not. So that was easy. As an individual, I felt, I was in a good place. My kids had completed college. We were financially stable. My husband was still working, but at what he wanted to do. And I was grateful that this came at a time where I could say, yes, I can retire. It wasn't my kids were in high school and I didn't have the money. So that worked. As a physician, it was a huge step for me. It was one of my biggest identities, being a physician. And to just drop all that and say, that's not me anymore, was particularly difficult. Of course, I didn't have time to think about that for the first several months, being with my family back in India. And it was something I had to pick up and put aside to deal with at a later time.
Well, I think there's been a lot of that in the physician retirement journey, that throughout the course of the career, these professional events make us put a lot of our personal life on hold. And now, literally overnight, the roles reverse and the personal life makes you put your professional life on hold. I find that to be really interesting, but maybe a little bit daunting or intimidating. You're not able to process the nature of terminal professionalism. It happens overnight that you're no longer practicing medicine, and you're not able to deal with that for several months. What was that journey like?
It was funny. My joke was that I went from a patient panel of 1,200 to a patient panel of one. And in India, medical care is given very differently. And so I would be the person calling the doctor and saying, this is what I think is going on. And I think I'll go buy this medication for her, rather than going to the doctor and getting prescriptions. Because in India, most medication besides narcotics, you can buy over the counter. So it was pretty much being her, her personal physician to some extent. And I think I missed the community, the camaraderie, the communication with patients was what really drove my career. And it wasn't so much the medical aspect of it. Sure, you give out medical advice and you have a treatment plan and you manage their care, but it was the closeness with the patient which mattered to me. And that suddenly stopped. And I think I had a very hard time processing that when, After my mother passed away, I had to take care of my father because he was 90 plus. And even though he was living alone and very functional, somebody need to manage his affairs. So till he passed away 2 years ago, I still had purpose. And now suddenly when he passed away is when it was, what just happened? I don't have anything to look, towards. I mean, I had my family, but they were all pretty self-sufficient.
Yeah, and let's talk about that just in greater detail. So for many physicians, that role of physicianhood is such a meaningful piece of their life. It provides 60 to 80 hours of work each week. It provides structure, cadence, call nights, relationships. And you kind of went through a replacement then with your mother and then your father, where you've got another role as a daughter and physician, pseudo physician, maybe not the primary care provider, but definitely educated in medicine. And then only once those roles evaporated and kind of went away with your parents, you end up now dealing with a lot of the things that you had set aside in terms of mourning the loss of your career. In our conversations ahead of time, you'd mentioned just the grief, processing the loss of your career and your purpose and role and meaning. What was that like?
I think it needed a lot of soul searching
Hmm.
and a lot of reflection. And I had to think about, when people would call me Dr. Mehta, I would be uncomfortable responding to that because I did not feel like a doctor anymore. And there was definitely the 5 stages of grief that I went through. And then a lot of who am I? There's more to me than just being a physician. I have to discover that side of myself. And of course, still find a purpose and still find structure. You're absolutely right. Your life is so rigid and regimented as a physician. This is work time, this is family time, this is, preparation for this talk, this is teaching time. And suddenly it didn't matter what time I got up in the morning or what I did all day. And it was up to me to decide that. And was I just going to float along in this, rest of my life as being carried by circumstances, or was I going to take charge and do something different?
Well, that's a powerful insight, and I think we'll run with this. I know we had talked about having a structure of talking about your career first, but Gita, this is such a profound story and so compelling. I think we should just jump right into that. You mentioned the 5 stages of grief, and you're going through this stacked on top of moving to a different country, losing your mother, then losing your father, and it seems like throughout that course, you almost stacked up a little bit of a traffic jam of things to process. And it feels like a bit of a waterfall, a bit of a dam breaking. And all of this probably gets released at once. In the meantime, rediscovering yourself in this environment. Really, the whole health and wellness brand is built around rediscovering your sense of self while you're still working. And what I'm hearing is you didn't have the luxury or benefit of doing this retirement planning, the personal retirement planning, until very deep into your retirement experience. Can you share a bit? You're always so open and genuine, Geeta. So would you be willing to share a little bit more about what that journey was like and shed a light a little bit maybe on the darkness or concerns that you had while you're processing this grief and rediscovering yourself and doing this soul searching?
Okay. So, while I would say about 10 years ago, when I was going through one of my burnout phases as a
Hmm.
physician, I discovered healthcare communication and I started training myself in that to a very limited extent because there wasn't much time. And I thought it was fascinating, focusing on the clinician patient experience and, how communication works in that and how it basically determines um, really the health of the patient because they will follow when they trust the physician or the clinician. So I had started work in that, and when things basically fell apart like this, and I had to think about what am I going to do, I said that seems like a good thing to do. So I pursued some training in that, and it's a National Academy of Communication and Healthcare. I got trained in that and now faculty in that. And that gave me some sense of purpose that this is something that is meaningful to me and I can learn this. And in the process of learning that, I discovered coaching and, got trained first as a wellness coach and now as a physician development coach. And it took a long time for me to figure out that it has to be something that's meaningful for me. It's not a matter of whether it really makes money or not. I wasn't worried about that because, we do have financial security. Um, and it had to be something more than just a job. It wasn't just a matter of getting out of the house to do something. It wasn't even so much of a career, but it was still more of a calling in the sense that it had to give me satisfaction, both for myself, that it was giving me meaning and personal growth, but it was also something where I was doing for somebody else and I could watch their growth. And in the process, I'm growing myself. So it had to serve that purpose. And it's felt to me that this is so aligned with one-to-one patient care that it has all the same, you need the same skills. You need the same listening skills, the empathic skills that you require in patient care, that it felt a very comfortable place. And believe me, it sounds like it happened very holistically. It didn't. It took a long time, and it took literally years of pursuing something and thinking, no, that doesn't work. Or, I went healthcare administration, for example. I did some of that, and very supportive people, but it didn't feel right, didn't sit right with me. And so it was a matter of trying things and saying, no, this is where the fit is perfect for me. And it suits my purpose of having purpose, being creative, finding equanimity,
Mm.
doing all the things that I think I need to do rather than just have a single path of a career. And I think it's satisfying all those.
Well, how profound is that? So for the listener who's hearing this for the first time, that the themes that I'm hearing are, you definitely had elements of your job that you were really enjoying, that you wanted to preserve when you got to, as you put it, return to active duty. In retirement, you do have to have this generative greater purpose. But how can we create that environment that really recreates some of the most positive elements of our career in medicine? And what is so shocking to me, Geeta, is so many people get into physicianhood and decide from a very early age, this is what I'd like to do. And over the course of their career, the environment of healthcare changes. And so they get this kind of growing list of things that they're looking forward to retiring from: medical records, pace of patient care, patient panels expanding probably to some extent to the limit and beyond in some cases. And so, how wonderful has it been in retirement to preserve some of those roles and responsibilities that are really feeding your soul and being able to say no to certain things that really don't? What has that freedom provided for you?
I have a lot of guilt about not continuing as a physician and taking on all those roles, but trust me, I'm perfectly happy not having to deal with charting and messages where, I love to communicate with my patients, but if you get 20 every night and each of them requires thought, there's no time left for yourself. So it it is a good place to be in, to have the benefits of what I had as a in my career, of the communication and the camaraderie and the community, and not have to deal with all that, the administrative side of the job.
Yeah, and I heard you say this too, Geeta. As you were talking through some of the things you did, it was not like it was an overnight success. Your retirement came with this exploration. And I don't know if you said it explicitly, but a bit of trial and error, where you're kind of poking around this path and then decided not to go that direction. What is that? Some physicians might think that's failing. I tried this thing and I failed at it. How much freedom is there in deciding what not to do and giving yourself some grace and permission to explore some things that may or may not pan out? So often I see this theme of physicians being very left brain, very logical. And if I do this, this will happen. And it sounds like retirement requires a little bit more malleability, a little bit more
Yeah.
creativity. Well, can you share a little bit more about that in your retirement experience?
Yes. It's a scary place to be, for one.
Okay.
You know, if you're in good health, and which fortunately I'm blessed with, you have a good 10, 20 years ahead of you. And what are you going to show for those years? What are you going to be able to look back and say, did I do something I could respect myself for? Did I make something of that time? It was handed to me on a platter. Did I just let it go? And it was very hard to get there. I think I also must say that my mother's passing was quite traumatic because of the way she went. She died at home, and I think they talk about, post-traumatic growth. I did not believe such a thing existed, but I did believe after what happened to me that it made me think a lot about my mortality and where I'm going to go with my life. Now that I'm supposed to be the older and wiser person, and that I think made a huge difference in terms of really putting thought into what is my retirement going to look like.
So it's almost, I'd hate to say your mother's death was a gift to you, but let's call it exactly what it is. It was a traumatic experience that ultimately led to a greater awareness. And the
Yes.
byproduct of that experience was the gift. And
Yes.
so, you were really forced with three successive challenging, stressful events, right? Retirement from practice, mother's passing, then father's passing. And then you come back to the United States and you're left to really find yourself in a very, very challenging environment. And so as you look back at kind of this rejuvenation of self, refining purpose, re-identifying roles that are filling your cup, are you doing this alone? Are you doing it with a coach? How did you go about that process of trial and error and keep that faith inside of you that you would eventually figure it out? Where did that conviction come from? And where did you find that support?
Well, I have to give credit to my husband. He's been incredibly supportive. It was whatever you want to do, just do it. And you can do it. And I'm right behind you. And I think that was the most powerful thing I could, a supportive thing I could ask for. My children are very supportive. And I think, frankly, having the financial security is what really makes the difference as physicians. You know, we don't live extravagant lives. We live a good life. And it's given me the freedom to pick and choose what I want to do without really having to consider, is this going to cost a lot of money? Can I afford it? And do I have to turn this around to generate income? If it brings money, great. If it doesn't, I have a retirement money from the university. So it's a good place to be in. And but I don't think I could have done it without the support. I would have went
Yeah.
with a lot of self-doubt and second guessing myself and ruminating on, is this the right thing to do, or am I wasting my time? I didn't consider anything a waste of time because everything was a learning opportunity. Whether it was good or bad, I learned something from it, and it's been quite a journey getting so far.
Well, I want to take it a step back almost to the beginning of that commentary piece because, as a certified financial planner, I've seen several physicians retire with a good financial plan and things go great. They've got a family to come back to, they've got their seasonal hobbies, they've got a purpose beyond their career, whether that's through Rotary or volunteerism or Habitat for Humanity. They regenerate this new lifestyle, the framework that they like to live with. But then there's others who had an equally powerful financial plan, so much financial freedom and security, and yet this transition can just be stumbling block after stumbling block after stumbling block. And I don't know their marital status necessarily. I don't know if their husband or wife is there for them the way that your husband was there for you. And so for your husband to sit there and really ask you the question, what do you want in retirement? And whatever it is, let's get that. I just see so many physicians over 30 or 40 years of their career not asking themselves that question since they made the decision to become a physician. Because the question is asked, what does the healthcare system need? What does the patient need? You mentioned 20 messages at night. Everyone else needs something from you, and there's no time for you. And then all of a sudden, retirement, it's a blank slate.
Yeah.
So, how did you go about exploring what you wanted once you had that freedom to do so? Once the role of caregiver for your parents went away, how did that conversation come about? How did you discover what you wanted?
It's a very good question. I think I had to step back and think about what is it that brings me almost peace. You know, what is the work that feels right? I wasn't looking for what makes me happy because I think that route is difficult. I went back to my previous hobbies, which I didn't have time for forever. I mean, I love to paint, so went back to doing that. And I wanted something that provides uh, a challenge and requires creativity and still intellectual, because with the physician's mind, you still want something that's evidence-based. And for some reason, this work in communication and coaching fits all of that. One of the best parts of the career was working with young learners, School of Medicine and medical residents. And some of this work with, developing and facilitating workshops brings me back to that again, even though it's not a medical topic, but it's still, interaction with young minds. So I think it was looking at what I wanted for my peace of mind, what would satisfy my quote unquote needs, and of course, what did I need for personal growth? Better personal awareness. So this was the work that sort of nourishes all that.
And
Sitting, thinking, reflection, a lot of reflection.
yeah, yeah, and having a safe space for you to do that too.
Yeah,
And so going through the turmoil and the processing and the grief and having a supportive environment for that, it sounds like it was phenomenally valuable.
absolutely.
Wonderful. Well, you brought up an interesting point. I'd love to jump into the idea of happiness. And so, in the book, we talk about this in Health and Wellness. There's three forms of happiness. There's the emotional happiness that you talked about, the hobbies. And it's a bit of it's called hedonic happiness, where you're eating the ice cream cone and the emotional response is to feel better, right? There's endorphins released through an experience that's directly tied to the action we took. And then there's this deeper happiness, the eudaimonic happiness, a moral happiness. And that seems to be more purpose aligned, not necessarily action, but a deeper, longer form. It's not high frequency, it's almost lower frequency. It's sustaining happiness. And the third being judgmental happiness, where you can say, I'm happy about or that something happened. And so the theory goes that if we can find a way to have all three, not just the hobbies, not just those things that make us happy when we do them, but a greater role, a greater sense of self can provide more of that moral happiness when we're living aligned with purpose. And then when we get to that judgmental happiness, I'm happy, as you said, we have 10 to 20 years and something that I want to be happy with myself that I invested. I'm happy that I did these things. That seems to be kind of that trinity of happiness that you brought up. So not necessarily just the emotional happiness is what I heard. Don't try those superficial things where eating the ice cream cone, eventually we all know what that leads to, right? And so
Right.
instead, what are these maybe deeper purpose, redesignation of roles in retirement, and how do we go about discovering that? And for you, it sounds like having that safe environment to really explore these concepts and really do, like you said, the soul searching. And if somebody didn't have such a supportive spouse, what role could coaching play in that?
I think coaching is the next best thing in terms of finding yourself, because somebody is walking with you to help you figure out what's important for you. And I don't think this can be done without some self-reflection. And I think coaching is a safe place to do that. And you're absolutely right. I had to find what was it that I considered meaningful and important, and happiness would kind of follow. It
Hmm.
wasn't something if you strive for it that you get it. And I think I've just been very fortunate, very blessed.
Well, fortunate and willing to do the work. I think we can celebrate that too, Gita, because Dr. Riley Moynes talked about the four phases of retirement. There's the vacation period, the sense of feeling lost and lost, and then that rediscovery phase, that trial and error phase. And if we don't have someone, as you mentioned, walking that journey with us, it can be so easy to get discouraged and
Mhm.
stuck in that feeling of feeling lost and a tremendous sense of loss and that grieving process and what comes out of that. And it's really only after the trial and error that we find the second, the reward is what he calls it, the plateau, where you've climbed the second mountain. You found that greater purpose. And so to have a coach say, I know these four stages. of the retirement journey. I know what we can do ahead of time, which unfortunately you didn't have the luxury of retiring well and developing closure for your career. But you were able to do the work on the back end afterwards and really rediscover yourself in the sense of purpose. And I love the phrasing that you use, that return to active duty. And so could you share a bit about the wellness workshops and the coaching that you're doing now in retirement and what that's providing you for a sense of purpose in all three forms of happiness?
Okay. So, return to active duty, I just must say that that is an actual title
Awesome.
uh, put out by the university, and it completely answers, like what am I doing? So I wanted to share that. And my work now is I work, and I've just started doing this on a more regular basis with faculty at the university here, and it's more of people finding themselves really of what is working, what's not working, what's going to make them feel fulfilled, what needs to change in terms of how they're going to survive in this career, and these are mostly mid-career physicians uh, who have this. I've spoken to, it's interesting, I speak to physicians who are towards the end of their careers, and they have it all figured out and they've sorted it out, and young physicians are, yes, lost, but there is the experience that comes with working that brings on a comfort level. And I think the hardest time for physicians is when you see the end in sight, but it's still too far away. And it's like, how many more years can I survive this, of this grind? And I think those are the people who really need most of the support.
Well,
That's
you
what I'm.
mentioned, yeah, so you're reinvesting in those mid-career positions to maybe counter the B word, the burnout, and say, what do we do when we're in this kind of mid-career valley? It follows a very same similar trajectory where we, see physicians getting into medicine, being very excited at the end of residency. They get into full-time attending mode. The world is their oyster. There's all this opportunity. And then all of a sudden, nope, the pace of patient care, the healthcare system, record keeping, it starts to pile up. Patient panels expand to or beyond capacity. And it does kind of lead to that valley of despair where you get the questions coming up. Is this what I want to do for the rest of my career? The burnout piece, the family life. We're going through a bottleneck in our home. And so for you to be able to provide that sense of hope, that encouragement, and really to be the sage along the journey there as physicians go through their own trial and error to find kind of a second generation of purpose in their career. I mean, how rewarding is that for you?
It's amazing. I'm constantly impressed by how hard people work in this career and don't even realize it. You put your heart and soul into this, and for patient care, that's, of course, what else could they ask for? But I also feel that physicians give up a lot of their, personal time, space, and I wish there was a way to say that, we can make more time for that, but the systems don't really allow that. So I learned from, the resilience of people, um, their commitment, their passion about taking care of the patients. And I find it so rewarding to be a little piece of that, their life of sharing what they're going through. And I think it leads to my personal growth as well.
Excellent. So we've talked about this on other podcast episodes, but you and I haven't talked about it directly. Um, that sense of being otherish. So this is an Adam Grant concept where you're putting other people first without sacrificing yourself. And so it's a way of serving others, but not to the extent that you're forsaking your own sense of self. And it sounds like you're able to guide people back to that kind of evolution of two side, like a double helix of positivity, where you're serving others, but not to your own personal detriment. It kind of becomes the symbiotic relationship between you and your environment and the relationships that you keep. How does that land with you?
That's true. That's very true. And I hope I make a difference. It if it helps, that's amazing. That's great. I do think, though, it's very hard to step away from it to even see what's happening, to look at the bigger picture for people. You're sort of in it. And There's no, there's no meta level of looking at what you're doing.
Yeah, I've got a really good friend who's a psychologist here at the hospital in La Crosse, Wisconsin, and his one of the most profound saying he's ever shared with me is it's very difficult to see the picture when you're painted into it. And
Yes.
it sounds like exactly what you're describing. You might be part of just this beautiful tapestry, this beautiful piece of artwork, and maybe even the focal point for many people when you're providing care in medicine. But to be able to take that view of it that has some perspective is phenomenally challenging, if not impossible, when you're so focused on just processing and working in that environment. And so, is that what you're providing in coaching?
I'm trying. And I must say that's exactly where I was. That was me before I retired. The hamster on the treadmill, the just surviving day to day to make sure that everybody is alive and well, and that's all I could hope for. So um, I hope to be able to provide that on a larger scale.
Excellent. Well, it sounds like you're on a phenomenal path with your retirement. Why don't we just go through a quick recap of our conversation here? We'll end our first of two podcast episodes by just kind of talking through the retirement transition and then into your purpose and finding that in retirement. And then I think in our next conversation, let's really dive into that whole integration of identity and finding that greater purpose within and beyond your career. How does that sound?
Sounds good.
Excellent. So, Geeta, again, thank you for sharing. It sounds like, your retirement journey was really accelerated timeline to the point where you gave 6 weeks notice and then you were done with your career. You were able to maintain that role practicing as a physician, but as a patient panel, not of 1,200, but of one for your mom, and then moving right on to caring for your dad. And so you really had some roles beyond your career that provided you purpose, but then processing all three of those elements of endings at once and really leaning on your husband to rediscover yourself and refining that purpose and having a safe space to get your feet back underneath you and finding that soul-centered purpose in life. And so now looking back, is there any advice that you'd provide to physicians considering or contemplating retirement, especially from a, let's call it non-traditional timeline?
Yeah. Well, the first thing is I would say don't wait to retire and say, then I'll figure it out. Because a lot of people do that. And I've heard people say, well, I'm just going to take 6 months off and then I'll figure that out. And I think one, it takes longer than 6 months. And I think if you start ahead of time to decide what is it you want to cultivate in after retirement, then it makes the transition easier. And I also feel that it's in those, people give themselves 6 months. It's very easy to get derailed and to sort of feel, should I say, rudderless to the point
Mhm.
that you begin to doubt as to what is the right decision. And it's okay to change your mind, of course. You can change your mind, but I think I don't like the feeling of panic, of being helpless, of being lost. And if you start before your retirement, I think that you can minimize that feeling.
Yeah, and still confront it, still
Mhm.
address it, still be curious about it, but not while you're simultaneously processing the emotions of grieving the loss of a career. It
Yeah.
sounds like doing those and setting them aside and trying to really change the timeline a little bit is a really powerful piece of wisdom from someone who's walked that journey. Well, thank you, Geeta, for talking about your experience firsthand and sharing that powerful wisdom with our listeners. It's permission to get started on this retirement transition before you get to retirement. And I think that is a very profound message to begin finding yourself outside of your career while you're still working.
Thank you, Michael.
All right, we'll see you next week.
See you.
Thank you for listening to this week's episode of the Health and Wellness Podcast. As always, I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwellness.com. We'll see you in the next episode.